Hi, I'm Olivia Speakman, and today I will be talking about the maternal mortality rate in Suriname. Maternal mortality rates in Suriname are higher than in any country of similar developmental or economic status. Data shows that Suriname had a maternal mortality rate, or MMR, of 120 per 100,000 live births in 2017, higher than almost all other countries in Central and South America, according to the World Bank. Additionally, from the World Bank, the average MMR among Latin American countries and the Caribbean was only 74 of 100,000 live births, almost half of Suriname's MMR. Why does Suriname have an MMR higher than that of its neighbors? It is not fully understood why, due to poor monitoring systems and unfinished records, but substandard care plays a part, according to Blomenkamp et al. Through a program aimed at better training for healthcare professionals dealing with births, Suriname's MMR can be lowered, and this should be a priority for the government of Suriname. Aside from subpar care, Suriname faces higher maternal mortality due to misidentification of deaths, and women of lower socioeconomic status are also more likely to die from a birth-related incident. The CDC places the importance of maternal mortality prevention on the women themselves, not on healthcare facilities, according to the CDC. Although the CDC is a United States-based institution, Suriname is a developed country and has the resources to have an MMR similar to that of the United States and fellow Latin American countries. Giving women the knowledge to take control of their pre- and postnatal healthcare is not the answer. Changing the MMR in Suriname begins in healthcare facilities. In 2017, 85% of all maternal deaths in Suriname took place in the hospital, according to Blomenkamp et al. How are we to entrust women to lower the MMR through healthier lifestyle choices when the very institutions caring for them are failing? The biggest factor causing these deaths is the delay in diagnosis, according to Blomenkamp et al. Hospital staff in Suriname are said to be adequately trained, but this is not evident in Suriname's MMR. An additional program should be put into place for these professionals looking to work in maternity wards, aimed at more thorough training. Late diagnosis points to a lack of monitoring of patients and leads to deaths that could have been prevented otherwise. Nurses should be better trained to know the warning signs of common causes of post-birth death, such as hemorrhage, infection, and eclampsia, according to the World Health Organization. Hospitals should redesign their monitoring systems in order to diagnose patients early and reduce the risk of further complication or death. This restructuring should start with better funding for the training and retention of qualified staff through the government. This training should include proper cleaning procedures. Infection, another common cause of maternal mortality in Suriname, is easily preventable. Most infections of post-birth patients are a result of unsanitary equipment, according to Blomenkamp et al. All hospital staff should be trained on proper cleaning procedures, especially those working in maternity wards. The lack of adequately trained professionals leads to these preventable infections. An improvement in postnatal monitoring and care is the only way to enact real change in Suriname's MMR. Personal health monitoring is valuable to saving lives, but healthcare facilities are the ones who must step up to reduce maternal mortality in Suriname. They all have all the resources at their disposal. Now they must use them. The government of Suriname should be concerned about the country's high MMR and should provide the necessary funding to restructure monitoring and training systems in hospitals. This may seem like a low priority issue to the Surinamese government, but if Suriname wants to continue to develop socially and economically like its neighbors, it needs to be a leader in low-end maternal mortality rates, not trailing behind. Thank you.